This is the Emergency Medical Minute, sponsored by Health One.
All right, good morning, everybody. This little medical minute about something we hardly ever see here in the emergency department is elderly patients that fall, right? I don't know if anybody's ever seen one of those. So obviously it's a very common thing that we see, and our first kind of job when we take care of, an elderly fall is just to make sure that there weren't any significant injuries, see what kind of injuries there were. So a lot of times they'll get CTs, x-rays, maybe some labs, and hopefully we don't find any major injuries. And a big thing that we can do with these is a kind of fall risk assessment. Elderly patients that fall tend to fall frequently. Even if they don't have a major injury from this time that we see them, they could in the future. And we can do some things that don't take that long to try and see if we can prevent them from having a more major fall. So they've looked at it, and I guess the first thing is just we can do a quick assessment. Like, was there anything obvious that caused this that we can deal with? Talking to the patients and their families and their caregivers, and even if we can't figure out why they fell here in the emergency department, getting them good follow-ups. So you need to see your doctor and talk to them about trying to prevent these falls. But a couple things that can be done that we can try focusing on. First thing is medications. Elderly patients are frequently on a lot of different medications. Sometimes they don't know what they are, and a lot of times the medications are sedating. They can affect their balance. Any kind of anticholinergic medication can make old people dizzy, make them fall. And for us, that might not always be reasonable to look through all the medications, but we have great resources with ED pharmacists. And, so if we have an elderly patient that fell, looks like they're on a lot of meds, grab the pharmacist and see if the pharmacist can go over the medications with them. Another thing that we can do is, maybe sometimes getting physical therapy to see them. If we think they're going home, but we think there's some balance problems, physical therapy can see patients in the emergency department and kind of work on fall prevention with them. And they've actually done studies when they had a pharmacist and a physical therapist see a patient in the emergency department after a fall. It really reduced the likelihood of repeat falls, admissions for falls, repeat visits to the emergency department. So, in summary, elderly patients that fall, try and figure out why they fell, maybe grab a pharmacist, maybe get physical therapy to see them here. We can try and prevent them from coming back with a hip fracture or a big head bleed. So, all right, any questions? Thanks, guys.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.